without any further ado, I would like to introduce our first opening session speakers. So here we have Gary Miller and Denis Sarigiannis and Roel Vermeulen. And what I just learned now is that Vermeulen and Miller actually are synonymous. Vermeulen is from the Miller, of the Miller, yeah. So there's some interesting synergies up here. So let me hand it off to Denis, and he'll get us started.
Thank you. Well, I think we're all excited to be here. We're really in for a treat in terms of creating jointly, I think, a unique trip to the moon, beyond the solar panel, the solar system, and beyond even. But really what it is, what I think this initiative is actually bringing to all of us is really a new era for the link, the relationship between science and policy. And I think this is really very important for public health, for innovation, so wealth creation, for actually sustainable development. So we thought we'd split this initiating session, which is sort of trying to provide a charge to all of us in terms of what we're seeking to do in these three little bits, where we'll be talking about the political, let's say, vision and the more strategic engagements required. So if we look at the actual role of policy in the exposome, so the way I say, usually like to talk to my students is that I tend to read books from the back, to the front. So really starting now from the outcome, which is indeed the policy repercussions of the work we're doing, in terms of how the policy can actually be affected by the exposome and vice versa. So indeed, policies shape health outcomes, and in the end, what we want to do is to enhance our positive impact on public health, and in this sense, exposome data can actually guide them. We do have, I think, an urgent need for high-resolution data, population-wide data, and actually exposure insights, both in terms of external exposure, but also internal exposure, trying to link with physiological perturbations and indeed pathogenesis. And that, of course, links with a number of strategic policy documents. And in the EU, where I come from Europe, of course, we have the Green Deal, so essentially sustainable development policy, One Health, which we all, I think we know, and of course a sustainable chemical strategy, trying to indeed enhance, the positive side of chemicals development. So I was thinking, when we're talking about creating these slides, what are policymakers? What are the policymakers' needs? They actually need evidence, actionable, validated evidence across the life course. I think the key word here is actionable and validated. As scientists, we understand the validation side, but the actionable, I think it is really a very important filter of what we're talking about. We also need a real-time risk prediction to inform regulation. I think that's very important because, indeed, we all know that we have delays in actually creating adequate policies for public health because of the inadequate data and the inadequate way of treating our risk modeling. We also need to work on the nexus between, of course, health, emergence of new chemicals, addressing the chemical exposome, if you want, and of course also in front of a canvas of climate change, which indeed also affects decisions. And indeed, we also need standards for AI-driven exposome analytics, because again, AI and the advent of AI can really be a catalyst in promoting and operationalizing the exposome for health, but we actually need to make sure that this happens in a standardized manner. So what we're talking about here is really a discovery-based, data-driven mission. So we're talking about the moonshot, but how is this going to happen? So we're really working beyond hypothesis-driven models, looking at discovery science for prevention. That means that we need to also democratize the access to data in terms of exposome data platforms, and of course create new partnerships, new public, private, and academic ecosystems of partnering, which I think is exactly what is happening in this room right now. And finally, to create, indeed, in this sense, a workable pillar for precision public health. And I remember a discussion we had many, many years ago at the NIHS, at the workshop where we were discussing what I came up with the term precision prevention at the time. And the discussion was, yeah, but you don't really want to distinguish for different people in public health. You want to actually protect everybody equally, indeed, but you also want to be cost-effective, efficient, and have results. And there you need to take into account, let's say, differences in vulnerabilities, of course, susceptibilities on an individual basis eventually, all the things that brings us all together and yet differentiate us, and that differentiates, indeed, health risk. So that's why we're talking about precision public health. And finally, of course, you cannot do this moonshot without having partners in this mission. So it's not just about the people in this organizing committee that were shown in the astronaut suits yesterday. It's really about all of us coming together, in a real sense, all of us. Otherwise, we just fail, okay? And so the point is about engagement. It's about engaging governments, very, very important. I'm very happy to see we do have very high-level officials from national agencies in the US. We also have a lot of support from the European Commission, but we also have, of course, from other parts of the world, Japan, China, Africa, and so on. We need to, of course, engage researchers, institutions, which, of course, I think we are all interested in, but also the people, citizens. And indeed, in a quadruple helix kind of approach, industry, the private sector. I think that is also very, very important, because we need to invest in national infrastructures, in AI capacity and capability, in indeed bringing on digital health records and data analysis. So finally, the idea is to actually create an Exposome Alliance in Europe. There's a number of initiatives on the Exposome, different countries. So we have indeed created, different instances of a European collaborative scheme, an Exposome Alliance. And I think we need to actually bring this to the global scale and indeed create this global Exposome Alliance. Finally, indeed, we all know what we measure, we can actually prevent, and indeed, what we measure and what we understand based on what we measure helps us to really prevent in an efficient and cost-effective manner for everybody. Thank you.
Yeah, I agree with Denis with this idea of connecting to policy and all these different sectors is going to be very critical. I want to give a little bit of our history of our field. I mentioned last night Chris Wild's paper that occurred 20 years ago, and I think this was very critical. He identified this need to have this complement to all the advances that were occurring in genomics. And then over the last 20 years, we've seen quite a few things happen here. One, I first want to note, this is the world according to me, because I made this slide. And so if I've left something out, please forgive me. But I think some very critical things happened. I mentioned again that in 2010, Steve Rappaport, Martin Smith, and many others, some were in this room, convened a meeting at the National Academy of Sciences here in DC. And that's really what kind of got things going in my view of that. I also think it's notable that Chirag Patel's paper from his graduate school days was the first environmental-wide association study. And you may note that second author is now the director of NIH. So that's a good thing to see that we know we have a leadership at NIH that is interested in this topic. And so over the last several years, the European Commission, they funded many different grants on the Exposome. We've seen different initiatives in the United States coming from EHS, led by NIHS, the CHEER and the HERE systems, and we've had many different meetings and developments. But what's just really exciting is that the slide gets really crowded on the right. There's a lot happening in the last few years, which is very good. And so we want to build on this momentum, learn from what we've learned, and just think about how we go to the next step. And to me, this is what this meeting is about, is we have gotten to this point. We've made a lot of progress. There's been a lot of activity, but we need everyone in the room to help us figure out what's next. Like, we've talked about this meeting next year in Barcelona that Martine Verheijden under the IHEN organization is going to host as one of our follow-ups. The STOA report in front of the European Parliament is moving along. We've seen a lot of activity at NIH, but what are the next 20 years going to be? Like, what do we want to accomplish? And that's what our working groups are about, is like, what are those milestones? What do we want to do? And how are you going to contribute to this? So, Walt Whitman, with that verse, you're going to contribute to it. And so that's really, to me, the charge for everyone in here is I want everyone to think about how they can contribute to it. And I think that even people who think, well, you know, I'm coming in here from a company or something, we don't do a lot of this work, is I think everyone does have something to contribute, either as a scientist, a policymaker, a supporter, a potential end user, someone who participates in the different studies that are involved in this. So, for example, like the U.S. All of Us study has, you know, close to 1 million people in it, and they're just everyday Americans that go into it, and we want to build more exposomics in that. And so the idea of being a participant in those studies is another role that people can have. And so, again, like I think that this, I don't think someone commented yesterday, I said the term blank slate. It's not a blank slate because we have so much we've been working on it, but we do want to work together to chart this. This is not one person's vision. It's a collective, not just the people in this room and people attending online, but the entire field. And so we have to think about how we leave this meeting and engage as many people as possible. So this is a very large collective effort of society to drive this forward, to have a better understanding about how the environment impacts disease. Another historical note, so I think one of the key events we had over the last about 1.5 years ago was the Banbury Conference on Exposomics, where we were working on refining the definition. And that was suggested by Tom Aniatis, who had been at Cold Spring Harbor and Harvard for a long time, saying that there'd been a lot of genetics and genomics at Cold Spring Harbor. But the director of the Banbury Center, Rebecca Leshin, sent me a note yesterday, and she couldn't attend because she's holding another meeting, but she was wishing us well. But she wanted to point out that it was 47 years ago that Banbury held their first meeting, and it was on chemical mutagens in human health. And actually, I got to read the quote. It's a good quote. So from the organizers, this is like, so 47 years ago. There is, of course, enormous variability in individual exposures, which results from a constellation of factors, including social, physical, and biological ones. Where one lives, works, or travels, and one's age, sex, eating preferences, smoking habits, or state of health, including inherited differential sensitivities, are just a few of the myriad of interactions influencing exposure and the subsequent effects determined by that exposure. So to me, what's so amazing is that people recognized this long ago, but they couldn't really do it. And like now, here in 2025, I think we're ready to do that. And so that's what we're here to do.
All right, thanks Dennis and Gary, and thanks everybody for being here today. And I'm really excited to be here with the next few days with all of you to see how we actually can indeed develop the program and about exposome research further. We already, I have been on this journey for quite a while, and Gary was already pointing out that it started really with the first tranche of exposome research that was funded in 2010-12. Paolo Denis, who coordinated one of these for early European projects, is actually here, and that has evolved into a large European human exposome network, which was an investment about 100 million into exposome research that really matured the field in the last 5 years, and that resulted now in the Banbury meeting, where we actually took for the first time stock of what we have been doing as a research program. What does it mean, what we are doing, and how should we actually continue this field forward? And that's actually the charge of the last two acronyms that are on this slide. IHAN is the International Human Exposome Network, and that is the coordination support action in Europe to try to combine all the exposome research on the European side and try to actually come up with a roadmap. And this I'm coordinating together with Martine Vrijheid, and it's actually the sister or the twin of the Nexus program. And that's why I think this time here is very unique, where both the European programs and the US programs and other programs in the world are coming together to start to think, how could we actually build a program together? And that's important because none of us, either from our discipline that we are involved in, or the countries that we are in, or the resources we have, can actually solve this picture. We all have an essential piece of that puzzle. If we actually want to go to an exposome program, to an exposome project, we actually need everybody. So I hope also here in these next few days that we actually can bring all these different pieces that we have to the table. None of these pieces is more important than another. If you're actually missing a piece, you can never solve the puzzle. So I hope that everybody is actually willing to actually share their ideas. The reason that I think what we need to discuss in these coming days is the why. We basically articulating that, of course, environment is a very important driver of health, but to actually have an exposome program or paradigm has been articulated by Caspar Safalou in a very nice commentary in EHP a year ago. And I was actually articulating that a lot of the knowledge that we have today, which is really important to be actionable towards different determinants of health, comes from hypothesis generating research. We had an idea that a certain stressor was important. We set up the right research to come to inference, and then that actually helped us to do policy or give it actionability. The point is that at this moment, we could argue that that approach has been very useful, but given the changes and transitions we have, may that be in our built environments, may that be in the chemical sphere, may that be in the social determinants of health, that it might not be adaptive enough to really keep up with all these new hypotheses that are there. The second part, and this has been articulated also in the definition, is that we may not appreciate the complexity of all these exposures. So what actually means when we look at the totality or the cumulative impact of these exposures towards health. The last part, and I think this was also true for genetics, is that sometimes we are not able to actually come up with the right hypothesis because we are lacking the biological knowledge to actually formulate that hypothesis clearly. And so this is really where we are here in this exposome program to think how can we open up a new avenue in the circle in environmental health next to hypothesis or together with hypothesis testing research to go to a more agnostic discovery-driven research program. And we need both of them. So this is not an or, this is an and basically one can inform the other one where the other one can also inform the other one. So we really need to open up this circle. There is momentum, and I think what is really important is that Gary showed this really beautiful timeline with an accumulation of efforts really towards the end. And what we have to do now is take stock what we have been doing over the last 20 years, take the lessons that we have learned from the things that we have tried, sometimes successful, sometimes failing and actually getting there, and actually now think together, how would a new project, if we have to design it de novo, look like? So I hope that everybody can put their own research to not as the principle of actually moving forward, but actually take stock of what we have done, try to think here collectively with others, if we actually are able to do this, design this de novo, what would we do? And what could you bring to the table in such a project? And I think it's really important to do that, not because we articulate an environment is an important factor for health, but it's also that it enables us to get more of all the rich data that has already been collected. If we want to get the most out of the genomic data, we have to supplement it with environmental data. The same, if we want to get the most out of environmental data, we have to combine it with genetic data. If we want to get the most out of the electronic health records that we actually have to see how we can get the contextual data into those data systems. That's why I was very pleased yesterday by Nicole Kleinstauer from the NIH to hear about the real-world data platform, which is similar or perhaps a mimic of the European health data space, where similarly in Europe we're trying to bring that data together. And I think this brings really new opportunities to actually learn new things. We wrote recently a report for the European Parliament. The QR code is here. I'm not going to cite the whole report, but it shows that the European Parliament is actually showing interest how this field is actually developing and what should be the next step to actually come to a Human Exposome Initiative or a larger program where we can really solve some of the really wicked problems that we actually have globally. That word globally is also important because this is not an effort that can be done in Europe or in the US. This is really an international initiative where we actually have to see how we can actually do a just transformation. Just a highlight summary of that report, and this is also the items that you may recognize in the agenda of this meeting. So what we articulated in the report were basically 3 research needs. One is basically more technological driven. Do we have the tools to really comprehensively measure the environment? The second one is, can we improve the measurements of the biological response that may come from these different stressors that we have? The other one, and that's really why I'm very pleased to see so many from different disciplines, is that we have to break those silos, because if we actually talk about the complement of environmental factors involving social determinants of health, chemicals, built environment, behavior, we actually need a lot of people from different disciplines. There are also important program needs. If we want to be successful in moving this forward, we have to think about how do we do alignment. And that's exactly why we are here today. Can we start to align these different efforts, how we actually do this research? We then have to think, how do we actually set up the infrastructure sustainably to actually support that kind of research? May that be analytically, may that be data. That's also the third point, is that if we really want to accelerate this field, we have to make that data fair so that everybody knows where that data is, so that we are not redoing research, or that we actually are easier in replication of different research findings. It's also a new field, and I know that we all speak a different language. We come from different fields, and we actually need to start training people so we better understand what everybody is saying. The last one, and this is really why Thomas Hartnung and his team really a key player in, to think about, okay, what is now the roadmap that we can take together to actually come to a fruition of this really important effort to build up to a Human Exposome Initiative, programs or projects. We need to actually from each other understand what it is. And that's important because if we want to be successful, we need to actually have a very strong use case articulation to our funders, to the public, to bring this forward. And that means that we actually have to do that both in the US, in other parts of the world, and in Europe, to actually have a unified idea of how we move this field forward. So I'm really excited to be here in these coming days. I think this is a pinnacle moment that hopefully when somebody else is on stage 10 years from now would say, yes, in 2005 something happened, in 2010 something happened, but in 2025 something really, really important happened. And I hope that we actually can have that slide in 10 years. And for that, I give it back to Michelle.
Thank you, Roel.